Good morning, healthcare leaders. Hope you are fine, doing well, and safe. Today we'll discuss the hospital management and operational in extraordinary time. Extraordinary time hospital management, it will take huge time, but we try to summarize the broad line within 15 minutes, we considering your valuable time and your busy schedule. Today we'll discuss the ordinary and extraordinary time, hospital incident command system, your staff, using technology and digitalization, managing the revenue cycle management in extraordinary time. In regular time, the professional person only who can differentiate between the professional and normal healthcare leader, but in extraordinary time, it's a time for professional healthcare leader only to take a decision or to lead that change. Understand that change and that challenge in extraordinary time is very, very important. Understanding the value of the time and decision, it may lead to different outcome if it is delayed just hour or 2 hours. In extraordinary time, you have to follow the national instruction and the national crisis standard of care. Hospitals and incident command system. If you have hospital incident command system, immediately activated. If you don't have, you have to immediately assign the hospital incident team. Who should be a member in incidents, hospital incidents team? Should be chief or should be a command, should be expert operational, should be infectious a disease person as a clinical person, should be infectious control or infection control person, should be finance and logistic person. This rule or one of the main rule is planning to who the patient should receive immediately the service, whose patient can be postpone this service or do the service with different way. For example, we'll decide which is emergency, which is elective case, outpatient visit, inpatient admission, medical, surgical, the visitor, which is coming for the patient, admitted patient, how to deal with the lab, how lab test, what is the running lab hours, all this will be assigned and should be planned. Following the national crisis standard of care, if you don't have national crisis standard of care, the planning will be included also what's the outcome, what is the goal for your services during the extraordinary time. Keeping healthcare place safe and healthy, this is the team activity or the team rule. Team should be proactive with the patient even before arrive to the hospital. If it is not practical or is not easy to communicate with the patient, to understand if the patient has some sign and symptom or suspected COVID, you have to deal with, before arriving to the hospital, you have to deal with the patient immediately when arrive to the hospital, before entering hospital, or immediately after entering the hospital by visualize screening to differentiate between the suspected case and the regular case. Change the suspected COVID patient pathway. Don't keep them sitting, don't keep them using the same elevator, same way to reach to the clinic. If you have a place, you can do special place for the infectious clinic or respiratory clinic. Minimize the exposure to the suspected COVID patient as you can. Change the patient waiting area, arranging with the distance to be avoid transfer from person to person. Immediately sterilize the area after the patient leave or before new patient will come. Don't put your staff all in front line in one time or in same time. This is a long time fighting. Please take care of your staff and minimize the exposure to your staff to the suspected cases. Communicate internally and externally. This is a new pandemic situation. We have to learn lessons around the world, see what's published in the research center outside, communicate with outside and see what is the guidelines, new instruction, even experience from other countries can be understand and can be customized to be used in your facility and be communicate external with the customized data with your team. Continuous training and updates, this is very important. Not only training on the how to use a PPE and how to save your site, your stuff, but also training by what is the recent research had been done, training to be ready in the worst scenario, how many stuff you can deal with ventilator you have, how many stuff can deal with ICU machines. It's very difficult, we know that, to prepare all your team, but at least the person who has skills and can be trained more easier should be ready to be second line to deal with ICU and ventilators. Subgroups, the assigned subgroups is very important to have special task to deal with, for example, labs only, to deal with inpatient admission. This is very important. Logistic management is during the crisis. It is will affect. It's very important, and it will affect your continuity of the service. You have to PPE and hand sanitizer stock. You have to look to your supply chain. You have to look to your cash flow vendors and try to redirect some cash flow to help you to keep all the stocks in safe amount. Immediately interfere the rapid decision and rapid decision making. It is very important. We see in extraordinary times the hours will affect the outcome of the decision. That's why the rapid and immediately interfere with the decision. It is very important. Hospital incident team should have the full authority to take a decision and to implement the decision immediately. Hospital incidents team supporting clinical management team by protocols and scenarios. Your clinical management team should be ready with the scenarios even in worst cases. And one of the most challenges we see they can face is the COVID patient with different disease. Not only COVID patient with pregnant woman, COVID patient with dialysis, with chemotherapy, with other service, inpatient with another condition with the COVID or suspected to be COVID patient. Emergency surgery with suspected and or confirmed COVID patient. It is very challengeable how to make intubation, especially we have OT rooms is already positive pressure, how to do intubation. Some hospital around the world is doing intubation by anesthesia only and keep all the other team for surgical team outside and waiting 15 minutes until all the droplets coming down, and after that they start the operation. Other hospital is based on the structure of the hospital. They can do the intubation in the negative pressure rooms and after that transfer immediately the patient. Based on your hospital, you can customize the experience for other hospital to be valid for your hospital. Monitoring room occupation percentage and ability to extend, ability put in your plan the worst scenario. May you will receive 1 patient, 2 patients, may you receive hundreds of patients. What is your plan if the worst scenario will come and you will start to receive more than your capacity? What you will do? How to transfer patient between facility during this time, how to have opportunity to expand your capacity as a hospital to deal with multiple patients. The next broad line is your staff. Caring of your staff, healthcare worker is very, very important to be able to give the service without any interruption. A smart screening for your staff before start the shift is very, very important to even collect the history of dealing with a confirmed COVID patient outside the hospital. You have to cut the chain of transferring COVID between staff and your patient and between your patient and the staff. Understanding the stress, physical and psychological stress for your staff, what is the psychological stress they are dealing with a very dangerous disease, how they protect themselves, train them to be able to protect themselves, try to provide them with PPE stuff to be able to protect themselves, but don't abuse the PPE stock because it will lead to a discontinuity of the service if it is finished, or it will lead to putting your staff in high risk. You have to manage or optimize the utilization for the stock for PPE. Copying stress, it's understand what is the challenge for your team, not only physical, even outside the hospital, understand shifting time during the even family requirements for your staff, especially when we have school off all this time, what's the timing for the shift. Try to modify timing, try to understand some requirement for some of staff to release the stress. Monitoring the percentage of the infection inside your healthcare is very, very important to understand how can you complete the fighting time with the high percentage from your staff. Using technology and digitalization is one of the very important to make remote dealing with the cases, the remote dealing even inside the hospital between staff. If you didn't start complete digitalization, you can start with the baseline, what you have, and then what's your plan? I need I need telehealth. I need just only making communication between the staff digital or remotely communication. Assign what is you need exactly, and then build a plan and the roadmap, and then test and start to work to deliver and testing, then make support. May this will be more faster than regular time and not going through all the steps, just assign and implement. You can depend on the ready-made product during this time, and you can remote management system, ready remote management system. Really, digitalization it is need alone one session to be discussed what's the outcome for digitalization, what's your planning, but we just go through the broad lines of it. Last broad line we're gonna to discuss it today is managing the revenue cycle during extraordinary time. To be able to manage your revenue and your cash flow, you have to understand how the hospital achieves the profit in ordinary time, number of the visit and the complexity of the visits. You can compare the same time, what you are now with the ordinary time. For example, you can compare today with the same day last year, and to be understand what is the defect in your revenue, what is the defect in your business resource, and modify the budget accordingly and put a plan to increase your business resource even through the extraordinary time. For example, you can use telehealth if the patient cannot visit the hospital. You can reach to the patient through digital or through telehealth, telemedicine, delivers medicine to the patient for chronic disease, for refill prescription. You have to assign where is the defect in resource of the business, and you have to deal with it. We're going to discuss this topic by more detail in next session with a case study with multiple example how to deal with the revenue, how to deal with cash flow during the extraordinary time. Minimize the controllable revenue loss. All the hospital, even in ordinary time, they have a percentage for revenue loss, controllable revenue loss. If you can minimize the controllable revenue loss during extraordinary time, it will be good for you to minimize your loss or to at least increase income or increase your revenue. We'll discuss by more detail like what we said, inshallah, next session. If you have any comment or any question or need more details, please don't hesitate to communicate with me with my contact detail. Thank you for your time and thank you for your